Our EDs are open for whatever the patients need. We are the only game in town 168 hours a week. We're here for patients 24/7. Whether it's a concern about COVID, or whether it's an injury, or whether you think you might be having a heart attack or something more serious, that's what we're here for. All of our EDs might have a slightly different process based on the design, the size, the volume of patients that come through that particular ED, but what we've done in every ED is they have to have a process, it may be different, for separating people right at the door. So what we're doing to keep people safe, which started during the height of the pandemic, the same due diligence, the same safety measures are in place, which is our staff are in full protective equipment their entire shift. Everyone is masked. Patients are masked. Visitors are masked, regardless of their reason for being here. We've also added thermal cameras at all of our entrances to get a second temperature check on the patients, but also to get a temperature check on anybody that walks through the door. In our waiting rooms, we're separating people greater than 6 feet apart. We do everything in our power to have no one in our waiting room. We'd like to get people in right away, which has always been our goal. We have the capacity in most of our EDs to have people in individual rooms, and at sites where we don't, we've set up areas for COVID possible and non-COVID patients. In between patients using our rooms, using our equipment, everything is thoroughly cleaned, and there's a real fine attention to detail which is required to keep everyone safe, our staff and our patients. And when patients come in on an ambulance, the same principles apply. At a very early staging point at the door or just inside the door, our staff in all of our EDs do that same screening, same temperature checks, same separating of patients into the right area of the department depending on their risk of COVID or an infectious disease. So what we're describing today applies to anybody entering our building. What we're seeing out there is an increase in pre-hospital cardiac arrest, worsening stroke outcomes. People are doing what we asked them to do, which was stay home, but taking that message a little bit too much to the extreme. And these time-sensitive scenarios, people are afraid to come. And I'm hoping to convince folks that they don't need to be afraid to come. And if they believe they have an emergency, that's what we're here for. We feel very confident that the measures we put in place protect everyone, staff, employees, visitors, patients, and we want people to get the care they need when they need it.